next thing we're going to go over is having a patient on their back. This is a sticky issue with patients because they're like, I shouldn't be on my back, right? And I've had feedback from OBGYNs where like, I can't believe you put a patient on their back. What do they do with you in the hospital? Is put you on your back for hours. So we have to be careful about that, but it's not like, oh my God, I'm going to have mortal harm by doing that. So it's very important every single time you lay a patient on the back, and even I'm going to be observing her to make sure she's okay, that she's not sparky, she doesn't feel dizzy, because the baby does indeed compress your arteries and goods and everything. So you just want to check in. If you have a patient that has low blood pressure, you want to be really careful about this, especially if you bring them up. They have a tendency to pass out. So if you know you have a patient with low blood pressure, you want to exercise extreme caution and really be mindful of that. So with her having her on her back, we want to start going over some of the stuff that you can do as a chiropractor for pubic pain. So the first thing we're going to do, you're like, surprise. So first thing you do is to do a test of the integrity or strength of the pubic joint. The pubic joint, as you know, are the two pieces right here that come together. They form in the center with a disc. So we're going to see how strong they are. And her being a ballerina, she probably crushed my head with her thighs. So what we're going to do is we're going to open very gently. Again, you don't want them to be a hero and like whack their legs out. How is that? Well, let me guess, you feel that back here in the SI joints. So the magic Mike spots, I always talk about these are the magic Mike spots, the dents, that's your SI or sacroiliac joint. When I do this, especially if they have a real hot back, you want to be really careful of warning, you're going to feel this in your back, okay? Totally normal. I'm going to have you squish my hands. You're going to squish my hands as hard as you can go. How's that? You're so strong. Glad I ate my Wheaties. Now, sometimes you're going to feel a little pop. You'll actually hear a pop. The first time that happened, I was like, oh my God, it came from down there. But it's so pressure relieving. It feels really good. You don't want any sudden movements or anything, but this is a great stretch for your patients. You can teach them. Right now, she's so pregnant, I couldn't have her put her hands. We'll show you in the later video how to have a patient do that themselves.